Today, I am proud to announce the government is launching the Palliative and End-of-Life Care Grant Fund. The new grant program responds to the feedback we received from the folks who care the most about these programs. It builds off the $9 million in funding we have already committed for other initiatives to service providers, associations, and in community groups to advance palliative and end-of-life care. Some examples include more than $1 million to the Alberta Hospice Palliative Care Association to increase awareness of hospice palliative care, develop volunteer training resources, and bereavement supports for Albertans. Another $1 million for the government-sponsored palliative coverage program to cover the costs associated with pre-filling syringes for palliative clients, and $150,000 to Pilgrim's Hospice Society to advance community hospice care. Through the New Grow Grant Program, Alberta Health is seeking project proposals from eligible applicants that support 4 priority areas: earlier access, education and training, community supports and services, and research and innovation. Eligible applicants include, but are not limited to, service providers, community groups, Indigenous organizations, not-for-profit organizations, and businesses. The application form, eligibility criteria, and program guidelines are now available on alberta.ca.
In all of my conversations, there were 2 very consistent messages I heard over and over again. The first being palliative and end-of-life care should start as early as possible. As I mentioned, individuals with life-limiting illnesses need to be comfortable overcoming that stigma and accessing what is important healthcare services to provide comfort for them in a time of need. Very vulnerable Albertans need to understand that the system is there for them, and that's one of the big things that we're trying to do by getting this onto one of the key topics, which is early access. And the second message I heard over and over with individuals was to remain for as long as possible in those familiar settings, in families and in the communities, and where we can have caregivers and family members there to provide for them. Not only does it provide better outcomes for those patients themselves, but as the Minister mentioned, it is so lovely for the families to have that comfortable setting so they can enjoy that time, the end of life with their dear loved ones.